A bone scan is a test which provides a picture. It uses a small amount of radioactive substance called tracer, which locates or monitors cancer that begins within the bones or cancer that has spread to the bones as it started from another part of the body. A bone scan can be used to diagnose the following few problems that can occur in the human anatomy. It can help to diagnose tumors or cancers such as breast, lung, prostate, thyroid, and kidney, also a fractured bone infection and the cause of bone pain. As well as it can help to determine if cancer started somewhere else within the body and evaluate metabolic problems, dysfunctions. As well as bone scans have the ability to diagnose tests substantially earlier than regular x-rays. Advantages. They have the ability to look over the entire human skeleton or selected parts. They can diagnose osteomyelitis 24 hours earlier than plain film. Disadvantages. They're not specific, need to correlate with plain film radiographs, poor resolution in many places, as well as they can have difficulty distinguishing different diseases from one another. To start, the test begins when a physician injects a small amount of radioactive material within the patient's bones. Once injected, the substance travels through the patient's blood and into the bones and organs. Over time, the tracer's effects begin to wear off, giving radiation to the body in very small amounts. The radiation that occurs is detected by a camera, which slowly scans the patient's body. The three-phase bone scan is used to detect bone infection. Pictures of the bones will be taken soon after the tracer is in the patient's body, and then 3-4 hours later once again, as it would have gotten into the bones by that time. If one wants to look at the metastatic bone disease, they have to take pictures of the bones 3-4 hours after the tracer has been put into the body. The scan has a duration of about 1 hour. The camera from the scanner will move around the patient. The hospital will ask for the patient to change into hospital gown, and they will be required to take off their jewelry as well as any other metal objects. If the patient is pregnant, they must inform their doctor, as well as one shouldn't take any medication which contains bismuth, such as Pepto-Bismol, at least 4 days prior to the test. The patient needs to let their doctor know if they've had an x-ray done which contains barium contrast material. The patient is also encouraged to drink a lot of water, as the radiation should not collect within the bladder, and they will be asked to go to the bathroom before the test. If the bladder is full, it can block the camera's view to the pelvis and cause for wrongful interpretation. Also, doctors may ask the patient to sign a consent form. As the needle is inserted into the patients, they may feel slight pain. However, during the test, no pain is felt. As the testing is going on, the patient must remain still, as they will be instructed when to change positions by the technologist. Because the patient will be still for a very long period of time, they may feel uncomfortable or discomfort. Normal results. If the test is normal, it means the tracer has moved evenly throughout the bones within the body. The results are classified as normal. What abnormal results mean. If the test is abnormal, the scan will display hot and cold spots compared to the other bones within the body. Hot and cold spots are pictures displayed by the scan. A hot spot is when the radioactive tracer has accumulated within the bones, whereas cold spots are bone spots which don't have a lot of tracer accumulation. Cold spots can display a shortage of blood supply to the bone or certain cancer types. Hot spots can indicate problems such as arthritis, a fractured bone, tumors, or an infection. It is the patient's physician's duty to speak to their patient and discuss any abnormalities. If the patient is pregnant, doctors don't advise for the developing baby to be exposed to the radiation. Therefore, they postpone the bone scan. If a mother is breastfeeding her child, it is vital she excretes the milk out of her system for 2 days, ensuring it is not provided to the baby. The radioactive material should not cause much harm thus larger risks are very uncommon. However, they can occur and might be rashes or swelling. Sunnybrook Research Institute will help to find new treatment plans for cancer and heart diseases through new imaging tests. This is possible because of the federal investment ensured by Gary Goodyear. The contribution will help to develop new technologies that will increase the competitiveness of medical imaging. It will help to create newer jobs and diversify the economy, as well as this will hopefully bring better and less invasive treatment options to the patients of Canada and the world. A donation of $6.91 million, Sunnybrook Research Institute has partnered with 19 other industries and Western University to commercialize 4 new imaging technologies. The contribution is being given through the FedDev Ontario's Technology Development Program. This could mean improvement in bone scans as it has a vast scope for development. The research and development of this project will take place in Southern Ontario. Not forgetting about the donations being made to hospitals of Canada throughout the year, this is a chance for Canada to expand not only on other parts of the hospitals, but provide more for the bone scan itself. Recently, philanthropist Emile Gustavo and husband donated $50 million to Princess Margaret Hospital. The donation will be given over a span of 10 years. However, the hospital is using it to expand on cancer research. This could mean improvement in bone scans as they look at cancer within the bones. Through this donation and the continuous donations being made by many, Canada could have a great impact on cancer research, which will lead to many improvements of the bone scans. This can help with not only cancer within the bones, but cancer throughout the human anatomy. Bone scans can have two costs associated with the technical fee, and the second is of having a specialist taking a look at the test. Bone scans are decently costly, and previously there was not a method for detecting prostate cancer otherwise. However, because of PSA testing, it has become a little less expensive, but anyone feeling bone discomfort should always get a bone scan done. This will help the economy as the government will not have to fund less for the bone scan machines and the testing. In Canada, patients have the free healthcare, which is why the government pays for a lot of our medical issues. By using the inexpensive way, we can have more money go towards development and research. Adding on, the tracers used within the bone scans are expensive to develop as well. Imaging testing itself is not economically friendly. This proves that the given economic factors, it is better and smarter to develop newer ways to diagnose the same problems. Stakeholders with the political and social factor would be people of the city as well as patients within the hospitals. We pay our government taxes and we want them to be used well, which they are. However, because they are donating a lot of our money, it means that the taxes will begin to increase. Then patients within the hospitals will get to receive procedures that have a faster healing time, as well as they will be less invasive, which will cause for less damage. Economically, the stakeholders are the government, as they are constantly being affected by the amount of bone scans needed. The more bone scans required, the more the government has to pay, which is why creating newer technology will help the economy and diversify the jobs within the economy. To conclude, I would like to thank you for listening, as well as I hope you understood what bone scan machines do and how they help us detect cancer, and the contributions as well as steps that Canada is taking in ensuring that we improve imaging technology. Once again, I thank you for your time.